you have been prescribed the drug called Warfarin. Over the next few minutes, we'll introduce you to Warfarin and help you understand why it has been prescribed for you. Starting on a new medicine, especially one you have to take for a long period of time, may make you worry. We want you to know that being on Warfarin does not stop you from living well and safely. It's important for you to understand how Warfarin works and what steps you need to take to maintain good health. Warfarin is a medicine that will keep your blood from clotting. It is the generic version of Coumadin, which you may have received while in the hospital. The drug is an anticoagulant, which decreases your body's ability to form blood clots and also helps to prevent existing blood clots from getting bigger. When clots form, you could be at risk for heart attack, stroke, and other serious medical problems. Patients who are on Warfarin must be watched closely. You will need to have blood drawn often to ensure that you are not getting too much or too little medication. The blood test is called the International Normalized Ratio, or INR. Your target INR will differ depending on the reason why you are taking Warfarin. It will take time for the drug to take effect, and so you will need to come to the clinic to have blood work done a few times a week. When we do your INR testing, we are looking for a certain INR level. This lets us know what your dose of Warfarin should be. When it's working correctly, your INR typically ranges from 2 to 3. Your clinician will tell you what your exact INR level is. Take your Warfarin dose as instructed once a day. It can be taken with or without food. Try to take it at the same time each day. We recommend that you take Warfarin in the evening. A pill box can help you remember to take your medication. If you accidentally miss a dose, do not double the next one. Be sure to always tell your doctor if you miss a dose because this could alter your blood test. When you are on Warfarin, there are many issues you must be aware of. Because of the way Warfarin works, foods that are high in vitamin K should be limited. These foods include dark green vegetables such as spinach, collard greens, broccoli, and leafy greens such as romaine and green leaf lettuce. Green tea should also be limited. While you do not need to completely eliminate these foods, your intake and portion sizes should be consistent from day to day. Avoid alcohol while on Warfarin, as it can increase the effects of the drug and may cause bleeding. You should be careful to avoid situations that increase your chances of being injured. Shaving with an electric razor is advised, and playing contact sports is discouraged. If you do injure yourself, especially if it's on your head, please contact your doctor right away. Also, if you need to have a surgical procedure or dental work, please let that doctor or dentist know that you are taking Warfarin well ahead of the visit so that they are prepared. Be sure to tell your doctor if you need to take any other medications, including prescriptions, over-the-counter drugs, herbal products, and nutritional supplements. You must always let your doctor know when you start or stop any medication. You should also avoid aspirin, ibuprofen, also known as Advil or Motrin, naproxen, also called Aleve, or any other anti-inflammatory medicines. And avoid certain antacids such as Pepto-Bismol, Alka-Seltzer, and Tagamet, unless prescribed by your doctor. It is very important to tell your doctor if you are experiencing any side effects from Warfarin. These include dark or bloody urine or stool, nosebleeds, vomiting or coughing up blood, unusual bruises, heavy bleeding when cut, severe headache, dizziness, weakness, unusual pain, swelling, changes in vision or speech, numbness, tingling, or difficulty breathing. Warfarin presents a specific issue for women who are of childbearing age. Warfarin is known to cause adverse effects on a growing fetus, so it is recommended that women do not become pregnant while on warfarin therapy. If you are pregnant or thinking of becoming pregnant, alternative medications can be used. Warfarin therapy requires the maintenance of a delicate balance in the dosing of the medicine, the food you eat, and in the way you live life. By knowing and following our guidelines, you will find that you can lead a full and satisfying life.